Good day to everyone. My name is Komathi Gnanasegaran, and the specialty that I chose to present today is cardiology. So cardiology is the study of the heart that deals with disorders of the heart and the cardiovascular system. So looking into the anatomy of cardiology, we have four chambers, which is the right and left atria and the right and left ventricles. So the right atrium receives deoxygenated blood from the body, while the left atrium receives oxygenated blood from the lungs. And the right ventricle pumps the blood to the lungs, and the left ventricle pumps the blood to the rest of the body. Also, in a heart, we have four valves, namely tricuspid valve, which is located between the right atrium and the right ventricle, bicuspid valve, which is located between the left atrium and left ventricle, pulmonary valve that guards the exit from the right ventricle to the pulmonary artery, and the aortic valve that guards the exit from the left ventricle to the aorta. A heart also has blood vessels, which are the arteries and veins. Arteries carries oxygenated blood away from the heart, while the veins carries deoxygenated blood back to the heart. A heart also contains three great vessels, which are ascending aorta, which is the largest artery that carries oxygenated blood from the left ventricle to the rest of the body. And second, we have pulmonary trunk. The pulmonary trunk originates from the right ventricle of the heart. It is the vessel that receives blood after it has been pumped out of the right ventricle. And thirdly, we have superior vena cava that brings deoxygenated blood from the upper part of the body, which are the head, neck, and also the upper limbs, to the right atrium. And secondly, in the anatomy part of cardiology, we have electrical conduction system. So in electrical conduction system, we have SA node, or also known as sinoatrial node. It is also known as the heart's natural pacemaker. The SA node initiates the electrical impulses that regulate the heartbeat. We also have atrioventricular node, or AV node. The AV node receives the electrical signals from the atria and transmits them to the ventricles. In the electrical conduction system, we also have bundle of His and Purkinje fibers. These structures conduct the electrical impulses through, causing them to contract, and delays the electrical signal to allow the atria to contract before the ventricles. Moving on to the physiology of cardiology. In physiology part, we have cardiac cycle events. So the cardiac cycle events involves the alternating contraction or systole and relaxation, which is the diastole, of the heart chambers. Systole is the phase when the heart contracts, pumping blood into the arteries. Diastole is the phase of relaxation, allowing the chambers to fill with blood. Secondly, we have the regulation of heart rate. Heart rate is the number of heartbeats per minute. It is regulated by the autonomic nervous system and influenced by factors such as hormones, temperatures, exercise. Normal sinus rhythm refers to the typical pattern of electrical impulses originating from the SA node. Thirdly, we have oxygen transport. The cardiovascular system transports oxygen, nutrients, and hormones to tissues and organs and remove waste products. Hemoglobin in red blood cells bind with oxygen in the lungs, facilitating the oxygen transport to the tissues. And lastly, in physiology of cardiology, we have regulation of blood volume. The kidneys play a role in regulating blood volume and blood pressure by adjusting the balance of water. So next, let's look into the diseases and treatments relating to the heart and the cardiovascular system. So the first disease we have is myocardial infarction. Myocardial infarction, commonly known as a heart attack, occurs when there is a sudden and prolonged disruption of blood flow to a part of the heart muscle. This usually happens due to a blockage in one of the coronary arteries, which supply oxygen and nutrients to the heart tissue. The lack of blood flow leads to damage or death of the heart muscle cells. So one of the ways to treat myocardial infarction is through medications. Medications like aspirin and clopidogrel are given to inhibit platform aggregation and prevent further blood clot formation. Another way to treat this condition is through cardiac rehabilitation. So cardiac rehabilitation is an essential part of recovery involving exercise, lifestyle modifications, and education to improve the health of the heart. Second disease that is relating to the cardiovascular system is arrhythmia. Arrhythmia refers to an abnormal or irregular heart, too slow or irregular. The heart's normal rhythm is coordinated by the electrical system, which signals the heart muscles to contract and pump blood. When this electrical system is malfunctioned, it can lead to various types of arrhythmias. So to treat this condition, antiarrhythmic medications may be prescribed to help regulate the heart rhythm. These medications can include beta blockers, calcium channel blockers, sodium channel blockers, and others. Also, devices such as pacemakers or implantable cardioverter defibrillators, or also known as ICDs, may be implanted to help regulate heart rhythm, especially in cases of bradyarrhythmia. Now let's look into a famous cardiologist. So the famous cardiologist that I chose is Dr. Eugene Braunwald. Dr. Eugene Braunwald is often referred to as the father of modern cardiology due to his transformative impact on the field. Dr. Braunwald received his medical degree from the New York University School of Medicine. He completed his internship and residency at Bellevue Hospital and the University of Cincinnati Hospital. Dr. Braunwald's illustrious career includes academic positions at institutions such as Harvard Medical School, where he served as the Distinguished Hersey Professor of Medicine, cardiologist at Brigham and Women's Hospital in Boston. Dr. Braunwald is a prolific author and has contributed extensively to medical literature. He is the author or co-author of numerous influential textbooks in cardiology. His textbooks, which is titled Braunwald's Heart Disease, a textbook of cardiovascular medicine, is considered a seminal work and is widely used by medical professionals worldwide. So, in conclusion, cardiology plays a crucial role in promoting heart health, preventing diseases, and providing comprehensive care for individuals with cardiovascular conditions. Advances in this field continue to contribute to better understanding, diagnosis, and treatment of heart-related issues, ultimately improving the quality of life for patients. With that, thank you.